So very warm welcome to everyone for this very first Reform Imperial Hackathon on realizing smart regulation in healthcare. So actually a few months ago, Reform published a project in collaboration with NHSX on the regulation of data-driven technologies in healthcare. And actually many of you who are here today helped out with that project. So thank you very much. And the project actually allowed to identify some of the main pain points or bottlenecks in the regulatory process. And actually, these are the ones that we are going to be working through today, or at least a selection of those. So I'm really delighted for this partnership with the forum at Imperial College, and hopefully today this hackathon will, provide some solutions to policymakers. Also, all of the work that you will be done today will be kind of recompiled into a write-up, which will be available, I'd say, within the kind of next 3 weeks after the event. It will, of course, be sent to you and publicly available on our website. So that's it from me, and I will now pass on to Professor Nick Jennings for his introductory remarks.
Thanks, Ellie. And thank you all for joining us for today's event. So my name's Nick Jennings, and I'm the Vice Provost for Research and Enterprise at Imperial College London. I'm also a Professor of Artificial Intelligence, and so the topic of today's event is of great personal interest to me. And I look forward to seeing some of the ideas that emerge from bringing together such an impressive group of experts from academia, from government and industry. Now, as you will all be aware, many areas of healthcare can benefit from AI, and data is a vital component of making this possible. AI offers us a real opportunity to automate some of the problem solving carried out by medical professionals and to make quicker and better decisions than humans can alone. AI systems working in partnership with humans have the potential to transform how we diagnose, monitor and treat patients, creating huge benefits to society and health services around the world. Now, the UK has a fantastic health service, and we also have leading researchers and technologists in the fields of AI and data. At Imperial, we have a wealth of experience in these fields, and through our focus on multidisciplinary research, we really want to be at the forefront of advancing AI and healthcare research. I'm going to give a couple of examples of the kind of work that we've been doing recently. So in one of the projects, we are collaborating with Google Health, DeepMind, the NHS and Northwestern University. And in this project, we've designed and trained an AI model that's been shown to be as effective as human radiologists in spotting breast cancer from X-ray images. Dr. Aldo Faisal, who's with us today, and his colleagues have also been developing an AI clinician, which has been applied to diabetes management, neurological disorders, and most recently to intensive care. Here, the AI system considers the monitoring data routinely collected in intensive care and takes decisions to maximize the patient's chances of survival through explainable recommendations. And most recently, Dr. Brijesh Patel is leading the DVENT study, a trial that's aiming to test a new AI device to help monitor the lung physiology of patients with severe COVID-19 pneumonia and to advise healthcare staff on the best ventilator settings for each patient. At Imperial, we have an AI network which spans all of our faculties, which aims to explore how AI can solve today's major challenges. As part of this, we've recently launched our Centre for Doctoral Training in AI for Healthcare to train the next generation of AI experts. And some of the examples of the network's research include smart medical imaging, human-like computing, and trust and security in AI. All of this research involves deep collaboration with NHS trusts to ensure that scientific advances are creating real-life impacts for the benefits of patients. And events like today are really an excellent opportunity for us to strengthen these collaborations and hopefully create some new ones as well. Now, I've spent most of my career in academia, but I also spent 6 years in government as the Chief Scientific Advisor for National Security. So I understand how important it is that experts assist government in developing evidence-based policies. Today's event is a culmination of a partnership between Reform and the Imperial College Forum, which is really focused on how we can make this all happen. The forum is our own at Imperial's Policy Engagement Programme. It brings together academics and colleagues in government together to learn from one another. And I think since we've had this, it's made enormous progress. And today's event, I hope, will continue with the success that we've already had to date. So I encourage you to think creatively about the data challenges that we're going to address in today's hackathon. I look forward to seeing how we can all work together to realise our collective ambition to transform healthcare through the power of AI. So I wish you all the best today. Thank you very much.
Thanks, Nick. Thank you very much. And now Indra, please.
Thank you. And thanks, Nick. and whilst I'm sitting here, my kids have left me some fake teeth, which I know is probably not a good thing to do, but you know, it's always good to have a bit of comedy whilst you try and talk about serious things. So I'm just going to share my screen quite briefly. There we go. Hopefully everybody can see it. If Ellie, you could give me a thumbs up. If that's up, perfect. So I will whiz through these slides, and apologies again to some of you who were there last Thursday. Shane, I can see your honours again, so now is a great time to get a cup of tea, so you don't have to listen to me say the same thing. Last year we launched the NHS AI Lab, or we announced it rather, and what we wanted to be really clear on is the focal point of the lab. There are lots of different areas of it. I'll talk over some of the progress we've made over the last, coming up to a year now, but the aim of this, and I think it's really important to this group, is it's about accelerating the safe adoption of AI. AI can do lots of wonderful things. We've heard about some of the projects going on at Imperial, but we've got to be really clear that patient safety, clinician safety, the public safety must come first. And so that's one of our focal points of the lab. Just a brief overview of what we've done in the last 6 to 12 months so far, since we made the announcement. As lots of you will know, that the COVID pandemic, when it came about, was overwhelming for everybody. And from a national perspective, we had a lot of people come and offer us help, both us in the national teams, but also to localities and regions, going down to GP practices, all the way up to sort of big trusts. And a lot of them came back to us and said, you know, we're getting all these people offer us help, but we're not quite sure. And you've put some guidance out there, but how can we actually make sure that the products they're offering us are useful for us, but also that we make sure we're getting the right solution and they're giving us the right solution. So what we did is we worked with lots of people, quite a number of you already on the call as well, to draft out what we've called a buyer's guide for AI in health and care. And we've taken some of the great work that our colleagues, Ellie, you mentioned the reform report earlier in the year, and we've put some of those in here. The draft is still, the guide is still in draft, so we're hoping to publish it more formally with the feedback later this summer, but it's already up on the website, so you can look at it on the NHSX website. If you put in AI Buyer's Guide, you'll get a checklist with right at the end of the page, because you'll find a link right at the end for the PDF guide if you're looking for the PDF guide. And in it, we put a glossary in for people who aren't too familiar with terms, but we've also put in just the steps you should go through when you're trying to procure some of these solutions. So please do take a look at that. And if there's any feedback, again, we're always quite open to feedback, and the feedback side email is on that as well. The second thing that quite a major program, and please bear this in mind when you're doing your hackathon, is understanding the need. People love talking about AI, but quite often it's like, well, what's the problem we're trying to solve? And then it's quite easy to understand. I say easy in inverted commas, but once you're very clear on the ask or the problem, getting the data and then doing the analysis or the machine learning on the data becomes a clearer process. And during the early stages, we were quite conscious that COVID being a respiratory condition, we wanted to support both researchers, but also the trusts to say, well, how can we start improving both the model development, but also the model verification of those companies who are coming to us to say, look, we're developing something in the chest space. So we developed something called it really rolls off the tongue, but it's a national COVID chest imaging database. We were able to do this quite rapidly because of the COPI regulations. So those of you who aren't familiar with the COPI regulations, they're a regulation that gets set out by the Secretary of State for uses of patient data in extreme or emergency situations, which this is one of them. And so this research is very much, bracketed under COVID-19. So we're not looking at sort of general care. This is related to COVID-19. The link obviously is on the NHSX website as well. And there's a lot more information there on both how, if you're a trust, you want to donate data, how to access data, and some of the more detailed programs that are under there as well. So here is just an overview of what we're trying to do. Is say, before COVID-19, we weren't quite sure what we were doing. Now we think we know what we're doing. It's not completely programmed out, but that's just an overview. And this is probably where people are much more interested in, because obviously it's a regulatory hackathon. Whenever I do these talks, I always find that regulation never gets the limelight, and I can see that there are lots of regulators on the call, and I can only but applaud you, because this is an incredibly complex and quite difficult to navigate space. And innovators quite often say to us, look, you know, this is really tricky. So we've been working quite closely with most of the regulators working in healthcare over the past, I want to say 6 months, to say what can we tangibly do that will be useful on the back of some of the work, Ellie, you mentioned, to actually help progress this landscape. So I'm conscious there are folk like Will and David Granger on the call from HRA and MHRA, but here is an outline of some of the programs that we're looking to fund and support moving forwards with the regulators. The key area a lot of people said to us is advice. As I said, this is a complex landscape. There's a fine line between what a digital health technology is versus what a digital health product is versus what just a health product is. And sometimes those lines blur. And so we're setting up a multi-agency advice service, and this is across the regulators and will be led by NICE. A second area that we thought was very important, and MHRA were very keen to progress with this as well, is what we call the technology vigilance. Many of you will be familiar with the yellow card system. Remember the old BNF, and there was a yellow piece of paper at the back which you filled out. Not only digitizing that, but understanding how do we create SOPs once a product is implemented into the care or the frontline service. MHRA have been doing quite a bit of work on synthetic data. It's shown to have some good value, so we're helping support that moving forwards. And then these area here, which a lot of people came back to us and said, these are real pain points, is verification data sets. So once you've built something, having a bit of data that is held back so we can actually verify models on them to say, okay, this is what you've told us, this is what your model does, or these are the outputs or the parameters. And this is for us as a system to help verify that. So we're looking at exploring some of those works and doing some discoveries. And the same with development and deployment. What very often happens, and we see this a lot, is people build products in a lab environment or in a research environment. And actually putting that into a clinical workflow is very tricky. Obviously, if you're providing an end-to-end solution, so for example, if you're an MRI scanner, that makes sense. But if you're creating a point solution, implementing that then into the end-to-end, into the clinical workflow at the end has been something that's quite tricky. And we've heard back from a lot of radiologists in particular to say this is something that they're looking for help with. And so we've made the decision to help fund some of that work. Now, I'm quite conscious some of my colleagues, both Brumi and Peter, will be joining the actual hackathon later today. And again, there are regulators on the call, so please do feel free to ping questions when you're in your smaller groups to talk a bit more about it. But this work is all kicking off now, so we're setting up all of those works and getting all those teams up and running. So watch this space to see how all of these works progress, and we will be quite open with how we progress with them. And the last thing I just wanted to give you a little bit of an update on, some of you may have been applicants or part of the AI Award in Health and Care. We launched this back in January with high hopes of going forward at pace and making sure that we could get funding out the door. Little did we know that a national or a global pandemic would hit a few months later. And so I know there have been frustrations with this because we've not been as communicative as we would have been. But here's just a bit of an update. We had lots and lots of applications. Over 500 applications were received and 47 in phase 4. So we broke down the award into 4 phases. 1 to 3 were very much research and development, and 4 was those that were market ready and wanting to be deployed either in a single site or multi-site. Unfortunately, during the time when we would have steamed ahead, lots of people were deployed onto other teams to respond to the pandemic, but they're all coming back now. So we're re-kickstarting this program. Those of you who are sites will have reached out to you, and those of you who are applicants will start to hear back from the teams. So all I can say is I apologize for the delay in this one in particular, and please bear with us as we progress to this. We're also very conscious that we want to do a second call, and so please watch this space for a second call coming up towards the autumn time. And that's it from me as a kind of an overview of the AI lab and the work we're doing, and focus particularly on the regulation work. And we're hoping to update the content that we've got on the website so it's a bit clearer on what we are doing, but also what other partners are doing, like the Office of AI, the Centres of Expertise, and the doctoral programs across the landscape, to add a bit more clarity of this quite difficult landscape to navigate if you're looking from the outside.